Welcome, everyone. I'm Dr. April Jasper. I'm the Chief Optometric Editor of Optometric Management Magazine, and I am so excited to be joined today by Dr. Richard Shuldiner. Dr. Shuldiner, I just want you to know you are amazing. I think everybody knows that, but what you do for optometry, what you do for our patients is incredible. And I'm so glad you're here to tell everybody a little bit more about that. So, welcome. Thank you so much for joining me.
Thank you for having me. This is wonderful.
And if you don't mind, Dr. Schuldiner, let's start with you telling everybody a little bit about yourself, your history with low vision, and how this all began.
Well, I am a low vision optometrist for the last 50 years, believe it or not. Became a diplomate in low vision in the American Academy of Optometry in the 80s. And I'm president of the Shuldiner Low Vision Training Institute. So I've been doing low vision my whole life.
It's incredible when you look at the difference you make in patients' lives. But I want to start by asking you about something I think that's really special, and that is the Richard Shuldiner OD, William Feinblum OD, philosophy and methods for providing low vision care. So can you tell everybody a little bit more about what that is?
Well, that's the name of our 4-day intensive low vision training. The name really came out of the fact that I worked with William Feinblum, who was the father of low vision care uh, back in the day. And really, his philosophy was take care of the patient and be able to have it be financially viable at the same time. So I created a 4-day intensive training, which does that. It's really designed specifically for private practicing optometrists who are interested in really two things. One is the professional satisfaction of really working with a patient for an hour who's really upset and kind of lost their future of what they're going to be because of their vision loss and aren't sure how they're going to manage their life, and being able to sit there and actually turn it around and give them a whole new future. And then the second thing is adding a profit center, which is financially rewarding. Low vision can be very financially rewarding. It's a service that is not covered by insurance, and so it's cash based and can be very profitable. So you get two things out of doing the training.
So it seems almost impossible for someone to learn how to do what you do in 4 days. Tell us how that works, and is it in person? Is it virtual? What is that all about? Walk us through it.
Well, doctor spends 4 days with me in California.
Wow.
It's intensive and it's non-linear. In linear education, for example, if you look at parents that want their child to do dancing, for example, the first thing they have to do is go out and get the shoes and the costume or the tutu or whatever it is. So they have the materials, and then they go and take lessons, and they're taught to, move their feet here and move their body there and really
Right.
do dancing. And then you do it enough, and over enough time, you become a dancer. It's just a slow way of learning, but it works. Much faster is to actually work the opposite way. So I will work with the doctor for a good 4, 5, 6 hours on what it means to be a low vision doctor. And once we've got that transformation occurring, and I call it a transformation conversation, understanding the psychology of the patient, understanding who's sitting in front of you, the family, the whole dynamics of what it means to have vision loss. Once that doctor understands that and gets that and actually becomes what it is to be a low vision doctor, teaching him to do it and what materials to have becomes very easy. So we can get it accomplished in 4 days. We've got now 50 doctors in our group that have proven that it's successful.
I love that, but 50 doesn't sound like enough. So walk me through that. I can tell you I know of a few in my area, but not very many that actually practice low vision as a specialty. Is there a shortage? Do we need more doctors? It seems very much so that we do.
Well, there are over 8 million people in the United States alone that are visually impaired. And there just aren't enough low vision doctors to care for any amount of them. It's just ridiculous. So yes, we could use hundreds and hundreds of doctors doing professional low vision care in their practices.
So we know that it's necessary. We know that it's something you can teach in 4 days, which I think is incredible and so exciting. Just to be able to be there with you and see it done by the expert is amazing. But let's talk a little bit about the benefits of adding low vision to the private practice. Give me some more thoughts on that.
Well, on the financial end of it, it's very profitable. We're dealing with patients. First of all, one of the things that I teach is you can't see every type of low vision patient, unfortunately. There are some patients that don't belong in a private practice. They belong in a clinic where there's other services like orientation mobility, occupational therapy. There are some people that are so low level functioning that they really need a lot of services. They don't belong in a private practice. So we need to know who does belong in a private practice. It's someone with a level of vision that can be worked with, tasks that are reasonable, and devices that are built specifically for them so they really get the best benefit. So it becomes professionally satisfying because you're really helping this person. And second of all, it becomes financially rewarding because it's a non-covered service. People are willing to pay to be able to do the things they want to do and live the life they want to live.
I would imagine that when you are taking care of those patients, you also earn the trust and the patients that are their family. Is that the case?
It's a good practice builder. Yes, it is. Family members will definitely want to be coming to your practice if you're going to show that kind of care and concern. There's no question about that.
So, one of the things, Dr. Schuldiner, that I know happens in training of any sort is that we are inspired. We go down that path of training and we're now ready to get going in our practice. And then we run into some roadblocks. Do you provide support outside of that 4 day training?
We have a lot of support. We've really built a culture of sharing what works, what doesn't work. Our doctors are very good at communicating with each other. Plus, we have a monthly conference call in which we discuss various cases, various issues. We have an annual meeting. It's interesting. I'm going to grab my phone because I want to read you an email that I received this morning. One of our doctors got an email the other day from a doctor, Turkish doctor in Turkey, about a patient, and wrote to the doctor that his acuity was 0.1. And he did not understand what that was. So he sent an email out to all of our colleagues. What is that? And he got like 4 or 5 responses instantly. So today he wrote back to everyone. He said, "I appreciate the input from you all in helping me understand the decimal system of recording acuity. There have been several interesting explanations from docs with much more current math skills than mine." So we have really terrific support. And I'm always available for coaching. When a doctor goes back and starts actually seeing low vision patients, of course, they're very nervous. So I make sure I'm available and other doctors are available. I've actually had some of the doctors stop an exam in the middle and say, "Excuse me, I'll be right back." And they call me and say, "Okay, this is what I have. What do I do?" And we go through the whole thing of what they should do in order to help the patient. It's really wonderful.
That's great. I know that makes a huge difference in confidence building as well. And many times that's all we need. Once you've gone through the training, I know that the confidence level is not going to be there until you've seen your first few patients. So that's another question I have for you. Do you help the doctors that go through your program to also learn how to reach out and let others know that that's what they can do now for patients and to be able to bring in patients to their practice?
We have a complete turnkey system. So we deal with, first of all, what kind of patient are you dealing with? How do you do the low vision exam? We have a 12-step Shuldiner low vision exam of exactly how to go through the exam. We know exactly what devices to use to get the patient to be able to do what they want to do. And then we know how to market to get patients to actually call the office for care. So there's 2 ways. One is you go directly to the public. There's a big issue in low vision. Most patients have no idea that the service even exists. It's a real problem.
Right.
The number one question that I get from patients over the last 50 years, why didn't my doctor tell me about this?
Yeah.
So the second thing is, how do we get retina doctors, ophthalmologists, other optometrists to refer their low vision patients? And we've kind of conquered that. We know exactly how to make that happen,
Wow.
and that's part of the training. So we know how to, number one, get the phone to ring. Number two, how's the conversation on the phone? How can you have a very quick conversation on the phone to know if that patient does belong in your office or not? One of the first things when I developed this method in private practice, because I had been clinical director at the New York Lighthouse for 11 years, so we did what I call nonprofit agency-based low vision. So any patient that called and had a problem, we'd see them. Well, doesn't work that well in a private practice. So how do you know which patient belongs or doesn't? So I developed a really 5-minute phone conversation to know who does belong in the office, because I never want to see a patient for an hour, work with them, and then say, I'm sorry, there's nothing I can do. Oh, and by the way, now you owe me an exam fee. It's just not fair to the patient. So we
Wow.
want to know that they can be helped before they come in. We want the patient to understand what can be done. We want to manage their expectations. We can't cure them. We can't get them to do everything on earth that they wanted to do before. And we want them to know what the expenses are. What is their financial obligation? Again, we don't want any surprises when the patient comes into the office.
Yeah. Wow, that's incredible. I knew you had conquered all these things. I just wanted to make sure that people understood the value. And then
Thank
I
you.
think that the next thing too that I think always is a concern is how do you then educate other optometrists? Like, people that are listening today, some of them are going to want to contact you and they're going to want to go through the training. And there's others that are going to say, you know what, I don't know that it's right for me yet, but I certainly want to make sure I send my patients to someone like you. So
Very good question.
walk me through that.
How do you know you have a low vision patient sitting in your chair?
That's what I'm asking.
It's a it requires one question of the patient. Is your present vision condition inhibiting you from being able to do what you want to do?
Wow.
It's very simple, because low vision is not about vision. It's odd.
Yeah.
Low vision is about doing. Low vision is about tasks.
Yep.
What is the patient having trouble doing because of their vision loss, and how are we going to get them to be able to do what they want to do? So if their vision loss is inhibiting them, so it doesn't matter what the acuity is. A lot of people think, well, it's 20/60, 21. No, it's not an acuity issue. Is it affecting your ability to do what you want to do? To drive, to see street signs, road signs, reading, working on the computer, playing cards. You may think, playing bridge is, what's the big deal? So you don't play bridge. But I had a case in which a woman was sitting in the chair. She was 82 years old, macular degeneration. And her husband was sitting opposite because he was observing. And I said, what do you want to be able to do that you're having trouble doing? And before she could even open her mouth, I noticed her husband was sitting there crying.
Oh.
And I stopped and I said, sir, tell me what's going on. And he said, well, she can't play bridge anymore. And that was our whole life. We were in a retirement facility, and we've lost all our friends because she can't play anymore.
Wow.
So fortunately, I was able to help her see the cards in her hand and the cards on the table, and she got back to playing bridge. It just altered their whole life immediately. It was really wonderful.
So one of the things I think, Dr. Shuldiner, that stops us in practice is we don't know how to have the conversation to even initiate that next step with a low vision specialist. And so by that, I mean, I think that many times we don't want to make the patient feel worse, but we want to ask them. So now we ask them that question, is there anything that you can't do that you want to be able to do? And what if they tell me, yes, I want to be able to play bridge? And I say, well, then I'm going to send you to someone who can help you. Is that the best way to do it?
Well, there's two possibilities. If you know a low vision doctor and you trust that person, yes, you make the referral. If you don't, you say to the person, look, there are low vision doctors out there that can help you. Unfortunately, I don't know one. you can do your research and find yourself one. It's interesting. Back in about 3 or 4 years ago, I needed to have bypass surgery, or at least I was told I needed to have an angiogram to find out what was going on. And I did. And when I awoke, because I was adamantly against having my chest being opened. So when my cardiologist woke me up from the angiogram, he said, your left descending is in deep trouble, and the first symptom will be sudden death. And I said to him, thank you, but they're not opening up my chest. And he said, they don't have to. They can do this with a robot without opening your chest. Now, I don't know who does it. I don't know where they do it. Do your research and find the best surgeon.
Oh,
Now,
my.
the cardiologist can tell me, and by the way, that best surgeon was in Philadelphia. And I went and I had it, and they did what's called minimally invasive bypass, going in through the side with a robot.
Yep.
And recovery was 5 days. The point is, if a cardiologist can tell me he doesn't know where and I should do my research, we can tell the patient, look, we don't know who a good low vision doctor is. Do your research, find them, and go get the service. So there's no reason why we can't do that.
Wow, I love it. All right, so here's the deal. I know a lot of people on this call are, and on this, watching us today, are very interested in bringing this into their practice. I've heard it from doctors all over the country. Every time I go and speak, I hear that there's so much interest. So how do they reach out to you, Dr. Shuldiner?
Either email doctor@lowvisioncare.com, or they can call me on my cell phone, 909-289-2628. Just call me up. Happy to talk about it, talk about what it takes to actually come out, what they can expect, what the costs are. It's actually not expensive to get into low vision.
And we also have the website in the comment box. So anyone that's watching right now or watching later, you can go to that spot and be able to look up Dr. Shuldiner there. Well, this has been so much fun, and it's been so good because Dr. Shuldiner, not only are you inspiring people to move into this specialty, be a part of the amazing group that you've put together of people that support each other, but also for anyone who isn't quite ready to do that, help us to know better how to work more with you in helping patients to get the care they need. So before we close, any last comments, anything you would like to share with all of our listeners and viewers?
Well, we certainly need more low vision doctors. There are so many people out there that need help, and I very much appreciate you having me on your show and discussing this. It's really wonderful. Thank you.
Thank you. And thank you all for watching and listening. We appreciate it, and definitely reach out to Dr. Shuldiner to learn more.
Thanks again.